For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
A pleasant good morning to you. Happy Monday, and welcome to another edition of the Pulse Radio Show. It's all about the Queen Elizabeth Hospital and how we can better serve you. I'm Communications Specialist at the QEH, Shane Seeley. Always good to be in your company right here in CBC land on Q100.7 FM. A big thank you to our sponsors, MedSafe Medical Supplies, who have been holding firm by us. They see the importance of us getting the information to you, and of course we'll share how you can be connected with them as well, because a lot of you need those medical supplies that they have to offer. It is Monday, as I said, Monday, November the 11th, a special day for the Queen Elizabeth Hospital, a special week really. We've started officially our week of activities. It runs from Monday to Friday this week, the 11th, through to the 15th, if my calculations serve me right. And yeah, we are going to be doing a lot at the Queen Elizabeth Hospital, and we are going to be doing even more on the outskirts of the anniversary. The official day is Thursday, November the 14th, and that's when we will do a special cake cutting ceremony, and we'll do some really significant things in our hospital for staff. But the public, you will not be left out at all, because our outreach continues, and we will have a special QEH public town hall. It's still in the proposal and planning stages, but very shortly we'll get some more information to you about how we will be doing further outreach, giving you a chance to be a part of our 2025 to 2028 strategy for the hospital. Of course, the CEO, Chief Executive Officer Neil Clark, would have launched our 2025 to 2028 strategy right here with you on the Pulse Radio Show. We've been speaking about it weekly, sharing with you different elements of it. Last week we got into Clinical and Diagnostic Services, and we will continue because there is a lot of meat on the bones of Clinical and Diagnostic Services. Of course, that directorate is led by Dr. the Most Honorable Corey Forde, our Director of Clinical and Diagnostic Services, back again with us on this edition of the Pulse Radio Show. We just came from the church service, the anniversary church service, which really kicked off the week of activities. So right now, our Minister of Health, the Most Honorable Dr. Jerome Walcott, he is there with other senior health officials, along with our CEO and other senior members of staff and the general body, giving thanks and praise for 60 years, the QEH at 60, of course, 60 years of dedicated service to Barbados, the region, and the world. And that journey continues under the 2025 to 2028 strategy. Dr. Forde, good to have you back this week. How are you doing?
It's great to be back, and at least I was able to participate in the early part just now of the church service, and got to hear our CEO and Minister of Health really give a vision for the hospital in the future, the near future, I would say. And it's really a privilege to work at an institution of this nature, when we compare it to many hospitals in the Caribbean, and we're far ahead, but obviously we can do better in many things at QEH. And I think this plan that has been our strategy that really has been clocked and made and looked after over this year, 2025 to 2028, is going to be a very strategic one, and I think a game changer for the institution. And that's always going to depend as well on our staffing as well. And I think I'd like to take the opportunity this morning to give kudos to all of the staff at the hospital for the tremendous work that they've done over the last 60 years. Some people, I understand, have been there for 45 years, older than me. And I think, there are many good things to come. And I think that all Barbadians will listen, and I really want to salute all Barbadians this morning for their efforts and even their comments and their compliments that they give to the hospital. I think often we talk about complaints, but there's so many compliments to the hospital. And I was just talking, if I may say this, I was just speaking to someone on the way in, and they were giving their experience in another country, which the name I'm going to call, very progressive country as well, and their experience in terms of healthcare. And and they really, I thought it was very nice of them to do a comparison between the experience that they've had in our own institution and that institution, a premier institution. And it was very encouraging. And I did have an experience recently in another hospital in a very metropolitan country, and I would dare say that the experience in Barbados probably was better.
And that goes to the service, which is really attributed to our doctors, our nurses, our ancillary staff, our security team. We're all working cohesively to improve. We're not perfect by any stretch of the imagination, but it's all about progression every day. The CEO does say, send those complaints. We hear them so that we can address those problems head on, so we can deal with them, so that the next time we encounter a similar situation, we can say that we have improved, we have done better. So it's all about the hospital, a community, a caring community, serving our community, doing better as we respond to the public demand over the next 3 years. Speaking about doing better at this same time, and I would have sent out this notice a short while ago, so of course I have to share it here on the Pulse Radio Show. Our QEH medical team is responding to a patient surge yet again in our accident and emergency department. We are responding to a significant increase in the number of patients, and this happens from time to time. And I'm glad that you're here, Dr. Forde, because you can explain the ebbs and flows of AED. You have experienced it, you've seen it in action, in wearing many hats, very many different hats. So you can share the experience and explain what happens from time to time. But the accident and emergency department is at this time experiencing a surge. The medical team is working to manage that surge in attendance, and we want to remind you about those other options for medical assessment and treatment to avoid any extended wait in the department, especially if your case is not urgent. And I'm going to come back to that, because when some people heard this before, they heard, do not come to accident and emergency. That's not what we're saying. We're saying, if your case is not urgent, and again, Dr. Forde can come in here to delve a bit more into this. If your case is not urgent, you have these other options, and let me give you them. And one you have heard me say quite a few times right here on the Pulse Radio Show. You have the Patient Advice and Liaison Service, or PALS, or Hospital PALS, or Help Desk, that you can call at 536-4800, and you can call that using your landlines, your cell phones, or you can even WhatsApp call between 9 a.m. and once we have these surges, we extend the service to 12 midnight, and our medical personnel there will be able to give an initial assessment and provide advice on your next course of action for treatment. And that advice may be to come to the accident and emergency department immediately, and they can also send an ambulance for you. So again, this advisory does not tell you do not come to the accident and emergency department. It gives you options options that you can use to get the best treatment at that point in time, and also helps you to make an informed decision so that you don't have an extended wait depending on your situation. Now, our medical personnel, as I said, will be able to give that initial assessment. Patients, you can also go to the 24-hour clinic, the Winston Scott Polyclinic at Gemmitt's Lane, St. Michael, or you can contact your private medical physician for advice on your conditions. Life-threatening conditions under our triage system will continue to be seen and treated immediately. Other individuals who present to the Accident and Emergency Department with conditions considered less urgent, which would be, and we will explain the triage system a bit here again for you so you can get a better understanding. It's good to have the repetition because you get it into your system, into your psyche. But those with less urgent conditions presenting during this current surge, you will have to wait a bit longer for treatment. We will continue to provide updates on our website. That's QEHconnect.com, www.QEHconnect.com. Also on our socials, on Facebook and on Instagram, so that we keep you informed about what's going on in the Accident and Emergency Department. And we will continue to work to reduce waiting times and offer you the best possible care and treatment. I want you to remember to call us at 434-1007. You can call us at 434-1070. That's while we're on the Pulse Radio Show. And you can also send us a WhatsApp on 434-1007. So before we get into your directorate again, Dr. Forde, and talk about all of the things that your team will be doing to enhance the speed of delivery and the care that you offer, let's look at this accident and emergency situation and explain to the public we're not telling them not to come, but you have options for care, options for assessment, and really options so that you wouldn't have to wait that extended period sometimes that you would have to in A&E when you have less urgent conditions.
Yes. We'll start by saying it's generally not my area of responsibility, but I mean, speaking as a physician and as someone who's been around for a long time, not 60 years, not 50 years, not just 40 years or so, all over the globe. And I think I need to say this because, and based on the last experience I had to take one of my friends to the hospital overseas. And sometimes these challenges occur. What I would say is they're unpredictable. So you see from time to time, you have a cohort of people who come in and they're ill for many different reasons. It may be predictable if the country has, for example, a dengue outbreak or a gastroenteritis outbreak or something. But then there are the unpredictable events. You might have a cohort of people who might come in at one time with strokes and heart attacks and stuff, and then there are other people, somebody who might fall and unfortunately have a break their toe, for example, or break their hand. But do they really need to come immediately to the emergency department? How are they going to be categorized? Like I said before, it's not my area, but I'm just using medical common sense here. And I think once the public understands that, I think one of the biggest challenges, I think, is communication. And I think that through this show and many other entities that we're really trying to improve that, so that people really understand the process for coming to emergency department, why you might have to wait. For example, I always give the example that I might come there and I might think that my stuff is urgent, but someone might really come in and have a massive stroke, and I have like 3-4 hours I can give them something that can try to reverse the effects of that stroke. If that was my mom, would I prefer that person to go ahead of me, or would I mind waiting a few hours to do that? And I think those are the things that we really need to think about. I think we need to be when we get onto this stressing country, people also need to know there's surge plans that deal with these sort of things. It's not something that you just wake up and say, oh boy, we have a lot of people. There are plans that go in place to try to deal with these particular events. But in that stead, the wait might be a little bit longer because of those particular challenges. And I'll tell you something from my own experience in internal medicine and being a consultant in internal medicine. At this time of the year, I can't tell you why, but at this time of the year, we often see a large influx of people into the hospital. So in that stead, I'm going to flip the coin a little bit on the call, and really to encourage Barbadians to take better care of your health. I know there's a lot of work going on at the Ministry of Health, talking about non-communicable diseases, etc. But I think we have to move healthcare in this country. It's a passion of mine in my brain, kind of like we have to move healthcare from being the problem of the doctor or the nurse. Healthcare is a reflection of you as an individual. So whether you decide to eat crazy, do crazy things, drink lots of alcohol, destroy your liver, it is up to you. And then there's simple things that you can do in your environment that you might end up in the emergency department. You might be one less person if you're smart, and just make sure around your surroundings at home, especially at this time with the rain falling, doesn't have a lot of collecting things, bottles and old tires and stuff that will lead to the breeding of mosquitoes, for example, and give some challenges when it comes to things like dengue fever and these sort of outbreaks. So I think it's the simple things that every single Barbadian can do to help the healthcare system improve and to try to stop or prevent some of the surges that we see. But I say that, but on the other limb, they're the unfortunate ones who may present with things, and people hate to say this word. And I was talking to my sister only yesterday, and she hates this word, which is called cancer. But that's the stark reality where we are. But I say that, as I'll talk a bit later about it, that we also can do things to be caught early to prevent some of those endpoints where you have to end up in the emergency department on occasions to deal with some of these challenges that may result from cancer. So early screening becomes important, and I was very thrilled and happy to hear the CMO make comments yesterday about the Scottish screening programs and that projection and soon to be disclosure of to the public on that particular issue, because I think that will change the course of where we are as well. Many of the reasons why people go to the emergency department at present are mainly related to these non-communicable diseases, which lead to some of the complications, strokes, heart attacks. Some people, unfortunately, not related to what I said before, may present with clots in the lung. So many things. And then there are the unfortunate events or the complications of diabetes. So we think about managing diabetes, but then people do crazy things that end up sometimes with consequences. For example, walking around barefoot, you got stuck in your foot with a very straightforward, me, stuck in your foot with a nail, and then you end up with a bad infection, and then you end up in the emergency department.
Yeah, COO is very big on footwear. COO, Dr. Greenidge, very big on people wearing appropriate footwear, especially those who are out there living with diabetes, because that can be a real problem. Let's go to the phone lines very quickly, Dr. Forde.
That was quick.
Yeah, before you get into your directorate, the 2025 to 2028 QEH Strategy under Clinical and Diagnostic Services. Good morning, caller. Welcome to the Pulse Radio Show as we celebrate our 60th anniversary this week. How can we help? What's your question or comment?
Thank you so much, Shane. God bless you. Good morning. How are you doing?
Well, you had to be the first caller today as we celebrate. Wow, amazing.
Well, the thing is, Shane, I just actually had my own celebration with my mom. My mom celebrated last week Thursday, and I celebrated last week Friday in terms of our birthdays.
Wonderful.
I was the 8th and she was the 7th, so thank you very much. Appreciate that. I have a couple of points this morning, Shane. I know that. Good morning to you, Dr. Forde. How are you, sir, my savior?
I'm good.
The Most Honorable Dr. Corey Forde. It's really a pleasure and an honor to speak to you this morning, sir. I would like to speak to you on a topic that I know that you are very familiar with. It is the stirring of dengue and the stirring of a lot of these diseases and scourges and plagues like COVID, that you're working on the root instead of working on the symptom. I know that the Wolbachia bacteria has been able to be given for the dengue for those mosquitoes to stop them in their tracks. And I believe that we must be able to work at the root of the problem. This is a great solution that has been had, but I would like to know a status update on that. A status update on COVID, that would be nice, because I know that COVID is ever evolving and ever changing, and I know that with the variant that with COVID, I know that that may be a little bit more trickier to get to the root of it. But I believe that we can do that, as you always say, that we as countrymen can do when we put our heads together, that we can level up and that we can have that therapy and that deliverance from the mental health and the spiritual health to get that multiple level up to get it done. Point, Dr. Forde, is that, and Shane, is that, I think that it's about time that we really seek to train the complete doctor and the complete nurse. I think it's time that we really train our doctors and our nurses in nutrition and the culinary aspect. Not only that, but we need to train them in stuff that I spoke about on this program before a couple of weeks back when Dr. Grange was here. The aspect of the color therapy, the olfactory therapy, those therapies, and not only that, but the aspect of some of the neuropathic. I know there's the oleopathic line where you're dealing with the symptom and thereby killing it that way. But there's also the naturopathic way where you're dealing with more a homeopathic way where like attracts like, and you're dealing with the aspect of letting food be a medicine and medicine be a food, where medicine started from the Hippocrates. And I believe that as we train the complete doctor and the complete nurse, as we train the doctor in nutrition, as we train the doctor in these aspects that they really should have been trained for ever since, that we can stop diseases like type 1 and pre-diabetes and diabetes that is not really a symptomatic, the symptomatology for is not symptomatic, but is more lifestyle and more really the root of it.
Yes. Just want to thank the caller. That's a mouthful.
That's a lot. That's a lot. I actually had to try to close my eyes and digest all of that there that you were saying. At least you got Dr. Forde here for the parts that I didn't remember.
So that's a mouthful. I'll try to address a few. So one, you spoke about dengue fever. There's been a lot of work going on globally on dengue fever, from vaccines to manipulation of mosquitoes, which is carrier factor, etc. But I think, although all of those things are going on, I think they need to go on. That research needs to be done. But I think although all of those things are going on, I'm just going to say this to every Barbadian and to the caller. Despite all of that, if there's no vector, which is, for simple, the mosquito, or a reduction in the vector, the risk of transmission is going to be down. So I think it goes back to that. How can every single Barbadian impact the transmission of vector-borne diseases like mosquitoes? It's the simple things that we do, right, that we don't think much about. Throwing out bottles, having the tires around, and even in neighborhoods with lots of old vehicles, etc., catching water. It's the simple things we do, and we have to be our neighbor's keeper, because sometimes our property is fine, but our neighbor's next door is not good. And I think that we need to work together. And listen to me. If COVID didn't teach us in Barbados, he said about COVID, I'm going to say this. If COVID didn't teach us anything in Barbados, then I think we're never going to learn. If we work together as a team on these particular infectious diseases, I think as a globe, not only as a Barbadians, as a globe, that we will do much better, because we're also struggling as well in that context with global warming and the challenges that brings in itself, and the different changes globally that we're seeing. And I do believe exactly in something that the caller said, and I just try to really hit home those important points before I get on to what I was really here definitively for today. And that's that. I do believe that we need to really diversify in terms of our training. I think the hospital is not being left behind in that. It will tell the caller that we are already part of the Chinese medical team, which comes to Barbados, practices traditional medicine. So we're not far behind in that thinking. But I believe that obviously we can do better. We can improve things in terms of the areas which you've mentioned. And you've mentioned as well about nutrition. I just wonder if you were peeping here in the studio and looking at the paper that I have right in front of my computer, which speaks to the impact and importance of nutrition in terms of health. And that's one of the areas that I am now responsible for as well, the nutrition services department. So I'll talk about that a bit later. So thanks for jogging that in my memory as well.
Indeed. Thank you, caller. Of course, he always shares with us right here on the Pulse Radio Show, has some interesting perspectives, so it's always good to get some answers for him and other callers.
He reads.
Yes, he does read. We were on Morning Barbados this morning, Dr. Forde, and recently we've been trying to gather those testimonials, those stories where patients talk about their experience. So along with those complaints, we have been gathering stories from patients, and I caught one off the cuff the other day, and I'll share it during the program just to let our listeners hear, to get a sense of and to paint a picture of the great work that our nursing team does. We hear complaints about the nurses too, but I want to share that story about the great work that our nursing team is doing after we hear from some more callers right here on the Pulse Radio Show. Good morning, caller. Welcome. What's your question, your comment, or suggestion for us?
Hello, good morning.
Hi, good morning. How are you doing?
I'm doing great. I want to call about, right? I had an MRI about 2 years ago. That's the 13th of April. And this year we made 2 years. I've been to the hospital. The hospital sent me over to Warren's to get the MRI done. I've been over there get it, and I went back up at the hospital a couple of times, and they said that they have not got any reports about it. I've been back up to Warren's, and the lady told me there that as soon as, because I don't know if the hospital is paying for it or what, right? So I asked her, so she said that as long as anything, body come in to have an MRI or anything, they do it the same, and they're sent it back to the hospital. So there's 2 years now, and I'm still waiting. April here was 2 years to hear from what's going on.
All right. I'm sad to hear that has happened to you. It is not a normal event. Should never be a normal event for you. I won't take your information online, but I'm just going to try to get your number after so I can give you a call to try to track down what's actually happened. It sounds very unusual. What I would say is, yes, the hospital does not have an MRI. You would have heard me say last week that you're going to be a happy lady because we're going to have an MRI at the hospital in Jewstead. So I think that will make you happy. But you still want to know your results for the last 2 years.
Yes.
So I'm gonna make sure at the end of this call that we take your number. And I can talk directly to you to figure what has transpired. Yes, we do MRIs go on the outside. Sometimes the results, well, most of the time the results will come back to the physicians. And I believe that this I don't know your name. I would love to know your name, but I think when I think about this from a real perspective. The results are set back, and I think some of the times we're still dealing with paper. And I believe that when we get our new health information system, what you're talking about, my friend, can I call you my friend? What I can tell you, my friend, is going to be a thing of the past, because that information is now going to be transcribed back to us electronically. So you're able to see those records, and believe it or not, and this is something I strongly believe in. I was going to say it later, but I'm going to say it now. As that part of the health information system, part of, in terms of the director dealing with equipment and studies, etc., the patients will also have access. I believe that you should have access to your medical information. In most modern countries, in most metropolitan hospitals, you can go and log in and you can see all of your medical reports, and you can share them with whoever you want to share them with. So I think we're gonna move to that. I think I just want you to be although you had this experience, I want you to be with us on this journey to improvement.
Indeed.
Yes, I will, because that I don't really have a problem with the hospital. I never was in hospital after I have a baby, and that was years ago. And and I never had a problem. We have a daughter that she born even before the hospital opened, the 1st of November.
Oh wow!
She is 60 years old.
Oh wow!
The 1st of November she was 60.
Oh wow!
So I never had a problem with the hospital. It's just that. Yeah.
So I'm glad you also said that. If I may, I ain't interrupting you. I love you. Right? I ain't interrupting. I love you. I'm glad you said that. For how much years? 60 years. And you never had a challenge dealing with QEH. That in itself, apart from this little event that you have here, is really, really good to hear. And I think there are many Barbadian stories out there which rings the same bell that you rang today on this call. So yes, you've had this challenge, and there will be challenges. I challenge you.
I know.
If you go to you can make me get in trouble now. You can make me get in trouble, right? But all I'm going to tell you is this. Recently, I went to like I said earlier in the call, I went to a very state-of-the-art hospital, and I waited a long time, and I couldn't even get my results. And that wasn't in Barbados, that was elsewhere, and one of the better hospitals you could think about ever. Right, so they have their challenges, and we have our challenges. I think what I want you to understand coming out of this call is that in this strategic plan 2025 to 2028, that what we're really, really, really working on and trying to get done is to try to get some of these strategies in place, some of these very some by my measure basic platforms in place, so that we can give you and every average Barbadian out there better service, understanding that yes, we recognize we have problems with communication, etc. But really, there's a drive to really improve things. But I need every Barbadian who's listening out there to be on this journey with us. It's not always going to be perfect. We can get some hiccups in the road, but you know what? Barbadians and this country is a country of resilient people, and we can only do better. We can't do no worse than where we are. We can only do better.
Yes, and caller, I will ask you to share your information with our producer. She will take that, and we will have Dr. Forde give you a call. And also, I hope you remember this number, 536-4800. 536-4800. You call that number, share your information with our medical team, and we will best direct you how you can get your matter addressed. But Dr. Forde will also be giving you a call.
Pleasure talking to you, ma'am.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
You're listening to another edition of the Pulse Radio Show. Remember, this is season 2, and you can check out all of our episodes of the Pulse Radio Show on our website, www.qehconnect.com. You go there and you tap into our podcasts, which are available on YouTube, and you can listen to all of the episodes. We have a wealth of information there, anything you need to know. In the first season, we focused a lot on the various departments, and we had some of our specialists come and share a wealth of information here. This time around, we're spending a little bit more time on the strategy for the hospital over the next 3 years, and how we're enhancing the services. We have another caller on the line here on the Pulse Radio Show. Good morning, caller. Welcome.
Good morning.
Welcome.
Good morning.
Good morning.
Yeah, I want to speak to Dr. Forde there, please.
He's here. You can speak to him. But just let me remind you to, just in case you have your radio on, you can turn it down or turn it off right now and just talk directly to Dr. Forde so that we don't get that feedback.
Yes, no problem at all.
So go ahead, Dr. Forde is here listening to you.
Yeah, Dr. Forde, you can tell me what gives a person an infection in the kidney, as I was told. About 2 months ago.
Okay. So, if you don't mind, nobody knows who you are, so I don't think you will mind with this. Can you give me an idea of your age?
My birthday, then we.
Yeah, but tell me your birthday, tell me your age. You forget how old you are?
My age is 57.
You're 57, so you're still a young fella. But, yeah, so there are many reasons why that can happen. Yeah, there are many reasons. But the reason why I ask the age is because it's important. Right, and I'm glad you called in because it gives me another opportunity to talk to another set of sub people which I need to talk to. Right, you know Dr. Forde already. He keeps it real.
Yeah,
right?
for real.
Keep it real, right? So you're 57 years old. So one of the things you're gonna be faced with is that little organ that you don't even think about, called the prostate, right? So when you see about urinary tract infections in a male, it's usually a result of something, right? Female is a bit different, right? There's a little part which, you know, if it gets a bit large, sometimes urine don't flow like it's supposed to. So you know, if you leave stagnant water somewhere, what's gonna happen, right? Things can grow. You can see like moss spinning and stuff, right? So if the urine don't come out like it's supposed to, if you're trying to pass water and it's not coming out properly, and you know, some even behind your feet, you gotta go like 4 or 5 times, you know, something's off, right? Some man would say, man, that is just happening a little bit. You need to go and get checked by the doctor. So what happens is the urine can build up in there, and once urine builds up and it stays in one place, it can get bugs that grow, right? They can crawl up and they grow, and it can cause an infection that can spread and go all the way up to the kidneys. Or, right, that's a common one you'll see in men your age group. That's why I always tell the guys, go and get, you know, go to your doctor. People hate that test, but it should be done. Get your prostate checked, get your PSA done. Some of the other tests they'll talk about when the ministry puts out the reports done. But go and get.
It was not across here. It was in the hospital for 2 weeks in September, right? It's on the 2nd to the and got released on the 16th, right? So they said the kidney. The doctor said the kidney was showing great improvement, though.
Right, good, but that's
the injury. He called it kidney injury. He said it was showing great improvement.
But that's good news for you, and that's thanks to you fitting straight into why I have to talk about this, Martin, because. One is talk about prostate and the people going and get screening for that, right? But then two, the next part, you can have kidney stones as well. This can predispose you sometimes to get infection. Again, the urine can't get out, so what you can do, back up, and the buzz can grow. You ain't get in trouble. So when
it pass water and it flowing freely, right? And then in the burning on that.
No.
Even then, they didn't get in the burning on that either.
Okay, all right, no problem. So the issue there is now you have. The doctors in the hospital, they're giving you, I believe, if you had an infection, some antibiotics, right?
Yeah.
And those antibiotics will help you greatly in getting better and getting rid of the infection. And I'm going to use this opportunity to tell you something that's important. And it fits right into our 2025-2028 strategy. One of the things we're trying to do, you might not understand everything, but I can try, right? One of the things we're trying to do at hospital right now in terms of that strategy, part of that strategy is to improve the laboratory services. So we move in and you call in and I ain't know you, but you call in and did this brilliantly here for me, because what we're trying to do is to automate, as I said last week, the laboratory. And one of those automated machines is going to be one which looks at urine, right? So that's going to be able to give us some quick information that somebody ordinary have to go and look under the microscope, and you know, you're only got sufficient this amount of space and this amount of equipment. So move it from a manual perspective to a more automatic perspective. So maybe able to get a result on you faster from get that first piece of information. How is that going to help you as a simple listener out there? It means if I can get a result faster, I can treat you faster. And with the right thing from the beginning, right? That makes sense, right? And if I can treat you with the right thing for the beginning, it means I don't gotta be trying different things till I get back my report.
Yeah, you were saying that sometimes it does mean that your prostate might be getting a little enlarged.
Yeah, so you need to go and get that checked out if the doctors haven't done that already. Right? I'm sure they do that. But there are many different reasons. But in males, usually when a male gets a urinary tract infection.
Infection in the kidney.
Yeah. It's usually a result of something. Something would have happened, and usually the infection is moving upwards, or if something from inside is affecting you, like a stone, etc. So I'm sure they would have done all of that work up in the hospital.
Yeah, they would have done all that, especially when he was admitted, and then when he was on the ward and all that.
I don't know, but all I can tell you is this: the fact that you calling here to say this today, that you were in QEH, you got treated, you got better, and the kidneys are getting better, is testimony to the work of the doctors and the nurses and all the staff at QEH.
Even give me medication to bring home. I went and I went for the follow up, and they give me some more because sometimes when I come to the hospital might be short of the medication that it's supposed to get. So So you got that there as a backup in case you won't run out, you know.
Yeah, so they're looking after you, and I think that's what all of us.
So I just got to wait for Dr. Bell to call me now to get the date to get, you know.
Yes, a wonderful lady, isn't she? One of our nephrologists at the hospital.
I've never met her nor spoken to her yet, but yes. I heard so.
Yes. But it's good that you're better, and I'm glad that you're back home with your family. If you have diabetes and stuff, they also forgot to say that also predisposes you to these aspects as well. So I want you to take good care of yourself, take good care of the people around you, and encourage your other male friends who you hang with. I know you're hanging with some people, maybe, I don't know. Hang with them to encourage them to go and get their regular checks to keep it with the diabetes and hypertension. If something going on, don't say
something. Yes. Hypertension and like type 2 diabetes, that there it could be reversible as well, as far as I was told.
Well, there have been lots of studies or lots of things done for people who are early on in the stage of their disease. Once you have the hypertension and stuff, you got to do all the work, right? And as I said on this call, I think every Barbadian needs to understand healthcare is not just the patient. The doctor taking care of the patient, is the patient taking care of their health. You have to take responsibility for your health. You know,
it's got a lot to do with that too, you know.
Exactly, but I want you to recognize that. Every single Barbadian to recognize that. It's not the doctor you come to the doctor and they give you enough tablets and keep increasing the medication. But if you go home and you eat bad and you don't sleep and you're running about the place or not running about the place and just sitting down and be a couch potato, then you can expect some of these consequences to occur. And I think that we need to address that. I think one of the areas that I'm responsible for 2020, 2025, 2028 that we're looking at as well as improvement of, and it's a new one that's being really given to me, so I'm now feeling my way around, is improvement in nutritional services. And there are a lot, I'm going to address it this morning because it's the elephant in the room that people don't like to talk about, but I can talk about it. You know me, right? Which is obesity. There are lots of obese people in Barbados, right?
Correct. You've got to watch your weight too.
That's right. I am working on I am ashamed to say I'm working on mine, right?
Osteoarthritis. That's why it was totally got osteoarthritis, right?
Osteoarthritis. That means you're getting younger, but there are things you can do to improve that. If you heavy and got enough weight on your knees, by common sense, you can put more pressure, it can be more pain. If you lose some weight and come off the weight, it can improve. You're not going to reverse the problem, right? But you'll get improvement in terms of those symptoms. So it's these simple things that every single individual can do to improve their health that will get us where we need to get. That means there's going to be less people waiting. If every Barbadian eat right, exercise, do things right, some of you can fall off the curve at any emergency department. But if we all be in this together as healthcare professionals, and you as a citizen and me as a patient, all we decide that we're going to do the right thing and go the right way and eat the right way and do all the things that we're supposed to do, nobody will be complaining about waiting in the emergency department because there'll be nobody to go there.
That's the ideal, Dr. Forde.
That's the ideal word.
Ground provision is another good thing to suggest to people to yams and eating yam and soup and drinking soup and yam and potato.
I ain't gonna tell you, I came with my grandparents, so I know more about that probably than you.
You're right, but I would also say I've learned, and this is from being around doctors like Dr. Forde. My father's also a doctor, and people, everything in moderation. So you're eating your sweet potatoes and your yams and other things. That don't mean you can eat 2 bowls and then little macaroni pie on the side and some greasy chicken or fried chicken and I'm eating healthy.
Yeah, it's more than that. That's where even the nutritional services at the hospital come in. They're starting collaboration shortly for a bariatric outpatients clinic. If you know what that is, I'll talk about that at some point. Oncology and radiotherapy, so people have cancer, but Ethan, I always hear people talk about that obstetrics type clinic, which will look at managing people during in terms of nutrition during pregnancy and the complications that can happen with that. Weight management, which I think would be a good one for a lot of Barbadians to really sign on to and get involved in. And then how you manage your kitchen, like the kitchen at the hospital, and how we get food out, etc., to meet the needs of our people. So I think I want you to, as you leave off this call, I want to take 2 things with you from me. One, get your colleagues and your friends and let them know, they need to get themselves screened when you get a certain age, or if they're having any symptoms, to get themselves checked out. I think people shy away from being checked out.
I think that we got, cause even children know suffering with things too, so I think that
that's
we got
right. Obesity, yes.
I think that we get not only obesity, high blood pressure, diabetes, children got all that there too, so I think it's only got nothing to do with age, and I think that every 3 to 6 months, people generally speaking should go and get themselves checked out.
All right, you said it, I did say it. Very good.
Well, tell me something. If you get in pain in your right leg every now and then, not all the time, but off, now and then, as we say off and on, what that mean?
It could mean many different things. Go to your doctor. They're the best ones to tell you. I can't tell you on the phone, because there are many different things I can call. And it's frightening you on national radio. You go to your doctor. Use the man who just said every 3 months or so, get checked up on that and see what it is.
I got my personal doctor too, so I was never frightened to go and get checked up.
So you're gonna follow up with that one for me, because it would be wrong for me to tell you it's this or that on the radio for someone I've never seen. I'm a very particular fella. I love to see, examine patients, and that's how you get your diagnosis. Thanks.
Exactly. So in a case like that, you got to get your leg x-rayed or whatever.
Yeah, your doctor can advise you the best mechanism based on what they think it might be. See?
Right.
Well,
no problem.
Thanks so much for calling.
Thanks for your information, Dr. Forde.
You have a fantastic day, my brother.
Yeah, you do.
Bye-bye.
Thank you very much, caller, for sharing your experiences with us. You're listening to the Pulse Radio Show here on Q100.7 FM. I think now is a good time to take a listen to that testimonial. You'll hear her introduce herself. She came to the hospital and she had this is her experience. Just take a listen.
My name is Krista Solon, and this is my husband, Arlie Delaney. And today we are here to present the nurses of NICU with some self-care packages and also some packages for the babies as well, in honor of our son Kai Delaney, who passed away last year. Kai had a heart condition, and he was cared for by the NICU nurses, and we were allowed access to him. And while we were there, the nurses supported us, and we saw how much they cared for our son. And so every year for his birthday, we gift the NICU nurses some packages in his memory. And it's not only from us, but it's from our friends. We have some friends who have some small businesses, like the Banana Bread Queen, and she's actually baked for all the nurses. And then a lot of our friends have come together to give us baby items, diapers, that type of thing. So it's really a gift from us and from our family and friends. We were supported by Dr. Birchwood, who had really been instrumental in helping us through the process. And then she had allowed us access to our son because we knew he was going to pass away. And while we were there, one of the things we noticed, one baby cries, all baby cry. Wow. And all the nurses are constantly on their feet. We noticed a time we were there, we weren't eating, but they also weren't eating as well. We noticed they were drinking like lots of tea, snacking a lot. I am a psychologist by profession, and so I, of course, even in there, I was talking a little bit about self-care. And one of the things that, really imprinted on us was just the way they cared for the babies, not only our son, but we watched them with other babies as well. And, it was really love and sacrifice. They sang, they talked to them. And then even with us, just kind of talking us through, because we knew he was going to pass, and just them really encouraging us. So as we were there, we didn't sleep. We were allowed to stay for a long time. And every time we sat by him, there was a nurse supporting us. And so this is in honor of him.
I really want to thank and salute Krista for honoring and paying tribute to our nurses in the way that she did. Her outcome was not a positive one. They would have shared with her that the illness at the point in time that there was no recovery from it. They had to accept that they would lose their son, her and her husband. But still, every year on the anniversary of their son's passing, they pay tribute to our nurses by donating to the hospital, donating for patients and mothers coming through NICU, or neonatal intensive care unit. But they also donate to the staff because they see how challenging and how difficult their job is, being alongside the patient, so through their medical journey, through their emotional journey. But it is a journey, and the nurses are the ones who really are at the bedside, who are the support for the patients.
I really want to thank that individual for coming out and speaking and giving the experience, of course, for the donation, the generous donation to the institution.
Indeed.
And I believe that is really, when you hear stories of this nature, is really testimony to the efforts and the work of the nurses. I always say we don't always get it right, but most of the times we do. And I think that's an important thing. And to hear that, it kind of gave me goosebumps, because you can hear the passion, you can hear, how they felt, even though it was a difficult scenario.
And the most difficult scenario.
The most difficult, you're absolutely right. The most difficult scenario, they were able to see a light at the end of what looked like a dark tunnel. And I think that people, every single day, within QEH over the last 60 years, even way before it was a NERF, have had great experiences. And some have had some challenging experiences, and those are things that we aim to address in our 2025 to 2028. But this is not just a 2025 to 2028 journey. This is a lifetime journey of improvement for the institution.
100%. Let's go back to the phone lines and welcome another caller to the Pulse Radio Show.
We're busy today.
Very busy today. What's your question or comment, caller? Share with us.
Peace be unto each and every one this morning. Dr. Forde.
God bless you.
Bless you too. I'm so happy to hear you again. Glad that you are. It's very touching. Sorry that the couple lost their child. I hope it's not the only one. But it's very touching, but it's always good to give back. Yeah. And when you give, you always receive.
That's right. That's what the good says.
Sometimes you do, and it turns out that you the person that you do for don't appreciate it or don't acknowledge it, but you always get it done from somebody that you've never done anything for.
That's right.
And where the hospital is concerned, all of us should give back, because they give to us. You see, every week I go and buy big fancy phones and things like that. If there's anything that can be done, I am willing to give my little 3 cents.
God bless you.
Because I met some wonderful nurses, and some blessed doctors, especially my doctor, Dr. Gill, and Dr. Bernstein style. And I know you're a good doctor too.
Thank you.
So I hope and I pray, and I went sleep comfortable Monday night when I heard you say that MRI machine is coming in, because Dr. Forde, is hard for some people.
I
know it's something you try to get the money. If you don't have good supportive family or friends, sometimes you might get some, or you might not get none at all. I know, and I feel that when it comes, we should still pay something for maintenance or whatever for the upkeep.
Okay, that's a policy decision, but I think that what we have to do, certainly continue to do as an institution, is continue to support our citizens the way that we as healthcare professionals can best do, using the resources that we have.
In these times, in these times it's hard, so
that's right.
You know how the economy is, and you see how the world coming with wars and different things. So if we have to contribute something, we should.
Yeah, right.
But I know it won't be as much as if we have to go on the private side.
Listen.
But I'm very glad.
Yes.
I'm very glad that you're God.
Yeah.
Pray God will continue to God bless and protect you. Thank you, Sean, for bringing up this program. And
not a problem.
And to each and every one, I wish y'all all the best. I watched the parade yesterday. It felt good. And God bless my country, Barbados.
Yes, right.
Thank you
very much.
And thank you for sharing with us, for sure. And yes,
my phone call money then airways. Don't waste when they're talking to Dr. Forde.
Listen, we appreciate you calling him. You definitely do. And you put a smile on Dr. Forde's face. On
He's
his
a
face.
good man. He's a good person. Give honor here on the Joe.
Indeed. Thank you for sharing with us as usual. And we appreciate you sharing on the Pulse Radio Show. We have another caller here quickly. The time is running out. I know Dr. Forde was saying you're coming back here week after week, but you are sharing elements of the directorate, but through responses to some of the callers, because funny enough, it is kind of linking to them as well. Let's go to the phone lines. Welcome, caller, to the Pulse Radio Show. Talk to us. How are you doing?
Good morning, sir.
Good morning.
Blessed morning to each and every one of you.
And to you as well.
Yeah. I'm calling on the behalf of having your notes at the QEH. I was away from this country in a long time, and I came back here, and I went to the hospital, and my notes were still there after such a long time. But after 2 visits, I went to there, I wouldn't say which institute, which part I attended there, but they did not find my notes after 2 visits.
Missing notes.
Yeah,
we hear this problem pop up from time to time, and once we get that health information system up and running, it will definitely be a game changer in addressing that issue. But I say to people, anytime that you have an issue with missing notes, please call our patient advice and liaison service so that they can help direct you and see if you can find those notes for you, because they could be different places.
I
they
tried
could be with
before.
the doctor. You try calling 536-4800.
Not recently, but a long time ago I called and nothing has happened.
Yeah, well, this 536-4800 isn't that old. That phone line isn't that old. And what you can also do, please leave your name with our producer as well here on the Pulse Radio Show, so that we can directly follow that up for you. And it would be a situation where the next time you present to hospital, they'll be able to tell you when your appointment will be, that we will have those notes there for you. So
because
please.
I'm not crossing you, sorry about
It's
that.
all right.
Because the notes they're producing to me now when I go there is the department that I'm visiting.
Right.
And I was going there from 1966.
Oh, wow.
And they have nothing on records for me. If anything should happen to me now, they can't look back.
Okay. All right.
And I don't like that.
Okay, I understand it. First, ma'am, I would like to apologize, and I know you've been overseas for a long time. I think one of the interesting things you said is when you came back, they still had your files.
Still had it.
Yeah, but
still had them.
And I know which country it is because I listen carefully to assets, so I know which country it is.
Oh, you're like me. Yeah, I listen.
Yes.
I listen to the accents too.
Yes.
And I could tell where people came from.
Okay, good.
Yeah.
So I think the take-home point is exactly what Mr. City has said here on the call in terms of following up and calling. But I wanted to, as I said to the last caller who called in, is that QEH 2025-2028, we're on a journey to improvement. And I honestly believe, just like the country up far up there, I know exactly where we're from or we're staying, but I think just as they have a health information system, the NHS, I believe that with the introduction of the current patient management type of information system, that you're going to have to worry about missing notes no more.
Yeah,
right?
and I want to say also that I was there last Monday for a test, and I was so impressed about the machine that was there.
Of course,
to
because
do my test.
It's one of if you're talking about, I know what machine you're talking about too, but I think and I told Barbadians that last week, right? So we are really, there's a lot of money that's going into not only infrastructure development but equipment upgrades over the next, and this is going to be amazing. I spoke about so much of it last week, but I think it's going to amaze. It's going to transfer what we have. But I think then we can have equipment, and we can get in trouble now. We can have equipment and we can have infrastructure, but we also need to have to make sure that our personnel communicate well and continue to treat the patients with the highest level of of understanding and care, understanding people's sometimes desperation or feeling of desperation. I think you need to feel people and understand people. My principle in life when I'm dealing with a patient is to treat every single patient as though it's my mother or my father or definitely my grandmother. And if
I like to see that.
And if you do that, then people could never complain. I think that's where you need to get. So I really want to thank you for your call. I want you to call that number that was given,
536-4800.
right?
Yes.
And we're going to try to see what we can do for you, so that next time you go back up to the UK, that you can tell them good news.
And also leave your number with the producer so that we can give that direct follow up. Okay.
I was not living in the UK, but I visit there.
Okay.
But I was not living in the UK for a long time.
Okay.
Yeah, thanks a lot though.
Could you repeat that number again for me?
No problem. 536-4800.
4800.
Yes, please.
Thank you very much.
You are very, very welcome.
You all have a blessed and a pleasant day.
You too, man.
Thank you. And we're thankful for the blessings as we celebrate our anniversary. Unfortunately, we are out of time, and we always like to share the information with you. Remember, our QEH medical team is responding to a patient surge in the accident and emergency department. We have put out that advisory. You can check our website and you will see it in traditional media as well. And look out for more information coming from us on the Pulse Radio Show. Remember to check out our website, www.qehconnect.com, and we are also on social media as well. Thank you very much for joining us for our anniversary edition of the Pulse Radio Show. I'm Shane Seeley, Communications Specialist, and on behalf of Dr. the Most Honorable Corey Forde, our Director of Clinical and Diagnostic Services, I want to wish you a great week, and we will see you next Monday.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmet's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.